Hello everyone, welcome to PHTV Channel 4 in Palos Heights. I'm Sue Jankowski and we are around Palos with our good friend Diane Aducey, who is an insurance broker in our town. And Diane comes here every year about this time because this is when Medicare has some open time that you may want to either jump in or change something. And a lot of times it could become very confusing. I know there's so many parts and there's so many options that this is a great time to get that information so you'll make a good decision when your time is coming, which is coming up real soon, like in a few weeks.
Yes, October 15th.
Oh, there you go. So, and there is just that one window for the year. So if you have any ideas that you're going to be using Medicare this year, this is a good time to listen into this. So
Great.
I guess, Diane, the first question is, you know, how do we start? For people who are just starting this whole process, I think it is overwhelming at times to think about it. So how would someone begin to get that information and get going in this Medicare program?
Well, for someone who is just new to Medicare, like turning 65 and new, I always say they should just take it step by step, right? Because first they need to get their Medicare card. That's the first step. And if they're collecting Social Security already before age 65, that card comes to them automatically. If it doesn't come to them automatically because they're not collecting Social Security, they can simply go to a popular website, medicare.gov, G-O-V, not medicare.com, and they can sign up for Medicare A and B online. So that would be the first step. And they could sign up online about 3 months before their 65th birthday. And if they're going to get their card automatically in the mail, because they're collecting Social Security already, it'll arrive about 3 months before their birthday. So then they get this card and it says Medicare, you know, they have their name and there's an ID number and Medicare A and B. And then that's the beginning, right?
Okay.
So Medicare Part A covers, it helps cover inpatient stays in the hospital and skilled nursing facility stays and other things too. But mainly we think of it as, you know, a stay in a hospital, a stay in a skilled nursing facility. And Medicare Part A is premium free for most people. We don't have to pay for it when we're on it because we paid for it all those years that we were working and paying into the Medicare system. So Medicare Part A, pretty easy to understand, right?
Right.
And Medicare Part B, just as easy to understand. Medicare Part B, again, comes from Medicare, the government, and Medicare Part B helps pay for physician charges and surgery and outpatient testing and emergency room services, things that we use more than staying in the hospital.
Okay.
Right? So Medicare Part B, there is a fee for, and there's so much information around this, but right now, this year, the standard Part B premium for people new to Medicare is $144.60 a month. And, you know, people can be charged more because of higher incomes, and all of that information, I'm happy to share it, but then we don't want to be here for 90 minutes, right? Or they probably don't want to hear me talk for 90 minutes. You know, a lot of this information is in this Medicare and You book. Now, I realize that the only people who probably have this Medicare and You book right now are those people who are on Medicare or those people who are going on it in a month or so. So I would suggest for the other people that maybe have 6 months or something like that to wait, they can go to medicare.gov and they could download this book. Okay?
Perfect.
Before, I would say go to stop in the Social Security office, right, in Palos Hills and pick one up, but they're all closed.
Yeah, you can't do that right now.
No, can't do that right now. So Medicare A and B, that's the foundation of our medical care. And that's pretty straightforward. We can use any doctor and hospital we want as long as they accept Medicare. So Medicare A and B gives us a lot of freedom of choice, right? We have costs that we're responsible for, though, like deductibles and co-payments and co-insurance, and most of us don't want to have to pay for that, right?
Correct.
Right, so that's where the Medicare supplements come into play.
Okay.
Okay, and Medicare supplements will supplement Medicare, and it's funny that Medicare supplements are also called Medigap plans. Why they have to have two names, I don't know, but Medigap, Medicare supplement means the same thing. They're helping us with the costs Medicare A and B leave us to pay. So Medicare supplements, again, they're great because they're standardized throughout the industry. So there's 10 different plans, and once I look at these plans and try to figure out which one is the best for me, based on like coverage and so forth, I can be assured that that plan is available from other companies in exactly that format, right?
Okay. So what you're doing then is the other you don't have any choices about, and there is some monies attached to it. Then when you need the supplement, you do have choices, but yet the choices have been regulated, so it varies from company to company, but the choices remain the same. Am I getting that right?
Well, Medicare developed the Medicare supplement, so they developed the plans, and then they said to insurance companies, if you want to sell these Medicare supplements, you can, but they have to be in this benefit package, okay? Now, what's confusing and actually sort of comical is that the Medicare supplement plans are also identified by letters of the alphabet, which really, I can understand why people get a little confused. They'll say, we just talked about A and B, and that was pretty straightforward, right? And that comes from the federal government. And then they have to pick a plan to help with their Medicare costs, also known as Plan A, B, C, D, F, G, K, L, M, or N. So at that point in time, people just start to say, oh my goodness, this is a lot, right?
It's confusing.
Right. So all they really need to know is Medicare A and B comes from the federal government, doesn't cover everything. If they want to be able to use any Medicare-approved provider, hospital, physician in the country, then they can go with a Medicare supplement, still enjoying that freedom of choice and reducing their out-of-pocket expenses. Does that make?
That does make sense, but you don't have to get a supplement if you don't want to. You can just do A and B and hope for the best.
The last line you said was very accurate, hope for the best. Because if you don't have a Medicare supplement, Medicare A and B could, I mean, you know, well, I had a brother-in-law who this year was in the hospital for 90 days. Now, if he didn't have a supplement, he would have been liable for at least 30 of those days at a co-payment of $352 a day. I mean, that's expensive.
It is.
And of course, then what about the 20% for the surgeries that he'd be responsible for? I mean, so I think it's wise to choose a Medicare supplement. I mean, the more that we can contain our own costs, the more peace of mind we have, actually.
Yeah, exactly. So with the Medicare supplements, and there are 10 plans, is each plan then the same pricing?
No, okay, so the plans, they run from A to N. But there's a few letters missing in between, right? So usually it's Plan F, as in full, that was historically the most popular plan sold, and that covered all of the deductibles, co-payments, and co-insurance that Medicare leaves you to pay. So a lot of people said, oh, give me that, right?
Correct.
That would be excellent. They have no worries then. But then Plan G, also a very good plan, very similar to F, except there's one small difference. With Plan F, all deductibles are covered. With Plan G, there's one deductible that you're responsible for, and that's the Part B deductible, which this year is $198. But that's $198 once for the calendar year in 2020. So in 2010, when this Plan G became, they enhanced it a little bit, and that's why it's like Plan F now. Plan G has been very popular for the last 10 years. However, what the government did a couple years ago, as you recall, we spoke about this last year, they said for people who are new to Medicare, as of January 1st of 2020, which was this year, that those people couldn't buy Plan F because they couldn't get that Part B deductible covered. If you were Medicare eligible in December of 2019, you could buy Plan F. However, I was just working with someone before I came over here today, and the Plan F he was looking at, he was age 72, and the Plan G he was looking at, there was a $50 a month difference in the premium.
That's a lot.
It is a lot. And then when you remember that the deductible that they would be responsible for this calendar year is $198, it can make more economical sense to go with the Plan G, but it's always a person's choice, if they still have that choice.
If they do, okay.
Right, because someone new to Medicare this year, they can get Plan G, which is the most comprehensive. All the other letters of that alphabet, A, B, C, you know, so forth, they cover a little bit less than Plan G.
Now, so if you want to look at Plan G, are there still a number of companies that you can go within that plan? Like every
Yes.
plan has a number of companies that you can look at.
Right, so every insurance company that can sell Medicare supplements, they will usually sell Plan G because it is the most comprehensive plan. So that Plan G benefit package is identical with all of those companies, but the prices do vary.
Okay. So, but they can't vary that much. I mean, if they're selling the same thing.
You know, and what you said makes absolute sense, but sometimes it can't. It depends on what a person considers much, right? When you have two people in a household and maybe they're going to pay $60 or $70 more a month for that Plan G with one company than they would with another, I would consider
That's a
$60 or $70
Yeah.
a month a lot,
Right.
right? But if it's like 10 or 15, you know.
Then not so much. Okay.
Because, you know, a lot of people, they, just like everything we do, whether it's electronics or furniture, we have certain name brands that we're comfortable with.
True.
So I do think it's very important for a person to be comfortable with the company that they choose and make sure that their reputation is good and their claims paying ability is good. So it's because we don't want to have to, there's enough things to worry about that we don't want to worry about that.
That is so true. Well, okay, so then they need to pick a supplement. Is that only being done then in this window of time? This is the only time you do those things?
No, so picking a supplement is actually when a person turns 65 and goes on Medicare Part B for the first time. Because when they go on Medicare Part B, the medical portion of Medicare, that gives them a window of opportunity to enroll in a Medicare supplement without any medical questions asked. Beyond that 6-month window, most insurance companies will say, well, gosh, do you have this, this, or this? And we might not take you, we might charge you more, or we'll accept you. So this open enrollment period that is coming up, you know, that is for prescription drug plans. Medicare Part D, as in David, and Medicare Part C, as in combined. I like to use the word combined for that, and I'll explain it. So if a person has a supplement, that's great, right? However, some people may say, I don't want a supplement. I want a Medicare Advantage plan. And a Medicare Advantage plan, also known as Medicare Part C, combines the A benefit and the B benefit, and they can throw in the prescription drug component as well, so a person has an all-in-one plan, combined, A, B, and D, all in one plan. Now, the big difference about this, Sue, and people should be aware of it, Medicare Advantage plans can work really well for you, but you need to do your homework. You need to make sure, are my doctors and hospitals in that Medicare Advantage plan? Because unlike original Medicare and a supplement where you can use any Medicare approved provider, a Medicare Advantage plan will have a network. Now the network can be very expansive, right? Or maybe it isn't. So you want to look and see what type of Medicare Advantage plan are you enrolling in. An HMO, Health Maintenance Organization, where most often you need referrals to see specialists and you need to stay within the network, otherwise you'll pay more or all of your costs, except for emergency or urgent care needs. Or there's a PPO. So when like someone might call me and say, oh, I want a Medicare Advantage, well, let's look at your doctors. Let's look at the hospitals that you prefer. We want to find a plan that works with those doctors and those hospitals. And so a Medicare Advantage plan, people can enroll in the first time during this open enrollment period, or they could switch Medicare Advantage plans. And the reason so many people go for them is because the premium, unlike a Medicare supplement, a premium for a Medicare Advantage plan can be $0, $30, $50. And so it's just like, oh, well, that sounds a lot better than maybe paying $200 or $130, whatever the case may be. So a Medicare Advantage plan, though, has costs for the services that you receive. So with a Medicare Advantage plan, your costs are really determined by the plan premium and what services do you receive, and what are the co-payments for those services, and what are the co-insurance benefit percentage. So all of the Medicare Advantage plans cover, you know, hospitalization and physician services, but the co-payments can vary among all of the plans. Fortunately, with the Medicare Advantage plans, there is a maximum out of pocket that you would be responsible for, making sure that you use doctors and hospitals inside the network, and that maximum out of pocket could be $3,000, but it can't be, at least for 2020, it can't be more than 6,700. So people, then see, I can see. So then you're like, well, 6,700.
That's a lot of money. And also with that Advantage plan, okay, I see my doctors in the network right now, but I would think that would be fluid like anything else. That doctor maybe isn't in the network anymore, and that was your doctor. Now you have to select another doctor, even though you thought you would have your doctor.
That's correct.
So whereas with the other plan, you're always making the choices, and you're not having to get referrals.
Right. So with original Medicare A and B and a Medicare supplement, you're in charge. You're choosing which doctors to use as long as they accept Medicare. You typically don't ever need a referral for, sometimes the doctor might make a suggestion, oh, go to this guy or go to this woman, but it's not like, oh, you have to see this particular physician. So a Medicare A and B and a Medicare supplement gives you more freedom of choice and more flexibility. A Medicare Advantage plan can offer extra things, though. That's why they call it an Advantage. So a Medicare Advantage plan includes prescription drug coverage, the Medicare Part D, which we really didn't talk about yet, and it can include extra things like dental and vision and meals delivered to your home if you just got out of the hospital. And
there are a lot of advantages to that. Yeah.
So, and soon the commercials would begin, and and the flyers and the newspapers and everything. And so I think it's very good that people look into these so that, number one, they can switch if they want, or number two, they understand why they have a Medicare A and B and Medicare supplement, and why they've chosen that, because they want that freedom of choice. Mm-hmm. Where with the Medicare Advantage plan, you can, many people are happy with their Medicare Advantage plan. Mm-hmm. And we just want to make sure that their doctors and hospitals are in the network and that they are satisfied with the co-payments that they may be responsible for if they choose that plan.
Okay. Mm-hmm. Now, with the Advantage plan, you said you're getting some drug coverage. With the original plan, you are having to purchase drug coverage, and that is what is coming up, where you can change your drug coverage. And because we change what our needs are, sometimes the prescription that you have is not covered, and so this would be the time to say, hey, maybe I can get on a plan that does cover this.
Right. So Medicare, the open enrollment period, annual election period, as they call it, you can switch Medicare Advantage plans if you want. You can enroll in one for the first time, or, which is the more common thing I think that people do, is look at their prescription drug plan. Because when someone first turns 65 and they enroll in A and B and maybe they get a supplement, they choose a drug plan. And you are absolutely right. Everybody changes and their prescription drug needs change. So Medicare gives you the option of changing your drug plan every year between October 15th and December 7th. So October 1st is when all the drug plans and Medicare Advantage plans will be listed on the Medicare.gov website. So
that's good.
Yeah, so Medicare.gov, because if people write in Medicare.com, that's not what you want to do. So if you don't mind, I would just like to tell people the best thing they could do.
Go right ahead. They need to know.
Great. So Medicare.gov, you can create an account. You just go on Medicare.gov, green, white, and blue screen, and it says, oh, do you have a Medicare account? No, I don't have one yet. Because remember, it's different than Social Security. So you can create one. All you need is your Medicare number. You answer a few simple questions. Now you've got a Medicare account.
Okay.
Nice. So what's so special about having this Medicare account? Well, if I wanted to, I could go in and see any claims that I had. But what's more important is if I've had a Medicare Part D plan all year long, I can go in there and see all the Medicare prescription drugs I've used this year. It's called, once I created my account, I would say I want to look at Part D, and it says update or print your drug list. Now, it's a wonderful website and a wonderful tool, but they don't really give you a list of instructions, right? Okay. So update or print my drug list, and you click that, and it's like, voila, there's all the drugs I took this year. Oh, I take that one, I take that one. Oh, I don't take that anymore. So I could edit it, right? Or I've got a new one that's not on the list yet, so I can add it. So now I've got this pre-populated list, which is great, okay? So then I would say, well, I want to look at those 2021 plans. right? I said that right. And so then it will ask me, well, which pharmacies would you like to use? Well, now they give you 5 choices. And this is just research, right? It's nothing final. And I could say, well, you know, I'll pick some pharmacies around town, maybe mail order, maybe something different, up to 5, and I could always change it. I'm not committing to anything. So then then it'll show me all of the plans from the most comprehensive, meaning most cost-effective, to the least cost-effective for me, taking into account the cost of my drugs, the cost of my premium, my deductible, the cost and the coverage gap that we can always go over, and cost and catastrophic coverage. It's easy.
It just sounds wonderful. They didn't have that before, right?
Well, they had it, but it was a little bit different, and it was a little bit, it was different. They revamped it last year, but then when they revamped it last year, unfortunately, they let it out like in, I would say, September, and there were a lot of bugs. I mean, it was infuriating. It was terrible, but they fixed it. They've been working on it, and every day I go in there and something new is in there. Like it went from 3 pharmacies to 5 pharmacies that you can select. So I'm urging everybody to go in there and just play around with it. Play around with it now, and then Thursday, because I think that's the October 1st, right? That's when all the drug plans are going to be listed. You can go in there and you can see the most comprehensive plan. And so this year, Sue, there are 28 plans, right? Okay. So you can say, well, this sounds great, and then you're like, oh my gosh, there's 28 plans. So whatever comes up first, let's say XYZ, RX or something. These are all Medicare Part D plans, by the way.
Okay.
All Medicare Part D. You can just click Plan Details. It's a little blue box. And then it lists like 8 pages of information. Really large print. It shows you all those pharmacies that you put in, which one is preferred, which one is standard. Because we always want to use a preferred pharmacy because we get a preferred copayment then, right? And so that would be a good thing to take into account. You don't have to print all 8 pages, but just review it. Now, the beauty of this is like you say, oh my gosh, I'm going out to dinner now. I'm sign out. Next time, go back in, sign into your Medicare.gov account. Your drugs are all there that you've taken.
Good. You're not redoing.
You're not redoing.
Good.
You're just going in there and looking again. Because I would suggest to everybody that go in there and look in October and go again and look in November, right? It shouldn't change at all. But the decision that you're making from October 15th through December 7th is for 2021, and you're going to be in that plan all year next year.
You want to be sure that you made a good choice.
You want to be sure.
And also sometimes you overlook things. I know I do when I'm reading something and then I go back later, I think, well, I didn't see that. I mean, it didn't just appear. I neglected to see it.
Right. Well, because the first time you're on something, there's so much to look at.
Yeah, there is so much. Mm-hmm. So does that tell you, you put in all this information and then it has these different plans. So if I was taking 3 medications, would it automatically tell me which plans have that covered? Or am I looking at each plan? Does it have, my prescription?
Well, so sometimes some drugs just aren't covered. But when you put in your prescriptions and it then shows you, it starts off with this one plan, and there's going to be a cost in there for the remainder of the calendar year. So for 2021, it'll be for all 12 months, right? So it'll show you this total cost. So that total cost with the first one should be less than the second one and the third and the fourth. And this total cost includes what you pay for your drugs, your premium, everything. So of course, you being curious, you're going to say, well, what am I going to pay for my drugs? You click Plan Details, you scroll down, and you'll see if you chose Walgreens or CVS or Myers or Mariano's or whatever, you'll see that store, and then I'll show you for that drug what you'll pay.
Oh,
your copayment.
That's great.
Right. And so the one thing is, and we've talked about this before, Medicare Part D has a deductible, and next year it's going to be $445. However, some plans don't have the deductible. Some plans will say you have the deductible, but only for the more expensive tiers. Because, of course, all of our prescriptions are divided into tiers, right? Lower cost drugs are on tiers 1 and 2. Tiers 3, 4, and 5 are comprised of more expensive drugs, brand name drugs, or generic. So not all of our drugs will be on tiers 1 and 2, right? So that's the one thing that I find lacking on the website is I want to know, well, does that deductible apply in the beginning, in the middle, in the end? Well, each time I look at the store, and let's just say XYZ store, it'll say before deductible, this is your copayment. After the deductible is the copayment. Well, if it's the same amount, then usually it means that you don't have to meet your deductible first, right?
Okay, yes.
And then once you get beyond the deductible, that's the initial coverage limit, where your Medicare Part D plan, which Medicare has developed, has said you'll get help with the cost of your drugs. I'm gonna have to do a cheat sheet here. Oh yeah, so next year they'll help you with the cost of your drugs until your initial coverage limit is met. And that number next year is $4,130. How do you get to that number? By meeting your deductible, your co-payments for your drugs, and what your insurance company paid all together. So if a person uses, let's just say $350 a month in prescription drugs, it's the total cost of those drugs that go toward that initial coverage limit of $4,130. Okay. I mean, a lot of people, you know, maybe their drugs cost $10 a month. They don't ever have to worry about it, but this drug plan was developed for everyone on Medicare, people who use it a lot and people who don't. So what happens if you hit that $4,130, you go into the coverage gap, also known as the infamous donut hole, yes, right?
Right.
And when I first started coming here, the donut hole was like horrible, and you know, people had to pay the full cost of their drugs when they were in it, but now they just have to pay 25% of the cost of the drugs, the most they'd have to pay.
Well, that's a good change.
Well, right. And it's taken 10 years to get here, since it was 2010 when the Affordable Care Act made this change effective, but it was over a 10-year period. So let's just say, for example, someone's taking a $500 drug. Oh, that's a lot of money. And maybe they were only paying $42 a month during their initial coverage limit. But now they're in their coverage gap, and 25%, I'm thinking, is $125, which is still a lot, but it's not
500. Yes,
right.
exactly.
Right.
Okay.
So that's good. And then a person stays in the coverage gap until the end of the calendar year, unless they reach catastrophic coverage by having exorbitant prescription drug costs. And then if they reach that catastrophic coverage by the end of the year, then their costs are very low for their drugs, like $3 and change for generic, $8 and change for a brand name, or 5%, whichever is less.
Okay, well, you certainly don't ever want to get to the catastrophic zone.
I think it's whichever is more. I might have said that wrong. I'm sorry. Right, but some people go into catastrophic phase early in the year, so it is good to, and a lot of people will say, well, I'm not good at computers. You don't have to be good at computers. And you can always enlist the help of somebody or do it with someone, because that makes it a little bit more fun.
It does.
Yes. So Medicare. Oh, and might I always say, I always have so much to say. I'm sorry. So anybody on a Part D plan this year, I know that they got their packets. Because I know my husband got his packet. It's the packet from your plan that you've been in all year long, and it's to show you what your plan is going to be like next year.
Oh, that's good.
Yes. So, but no one really likes to open it because it's not fun, So, but they need to, because they need to see how much is that plan going to cost me next year. Oh, and is my deductible going to be higher, etc. So, open the package. Go to the Medicare.gov website. I don't know about going there October 1st, though, because I think the site will crash or something,
probably. Just wait a little bit.
Right. And then another thing, like on the back of these Medicare and U books, all the Part D drug plans in Illinois are listed in the back.
Oh.
All the Medicare Advantage plans listed in the back. So if someone just wants to say, I worked all day, I don't want to look at a computer, grab at the back of the book.
There.
Right.
Grab a cup of coffee and try and stay awake while
right.
you're reading all that.
And if you have questions, call someone, call the insurance company, don't hesitate, because you don't want to find that you should have asked a question that you didn't.
Now, if the Medicare.gov site is helpful, which it is there a phone number there? Like, can you call someone in the Medicare?
Oh, yeah, you can call Medicare. It's actually 1-800-Medicare. I don't know what the actual numbers are. Mm-hmm. The E doesn't matter at the end. They can call 1-800-Medicare, ask questions. If they want to not go directly to an insurance company, they could just go to 1-800-Medicare and ask questions about the plan.
I mean, that may help too, especially if you're not real savvy or you don't feel comfortable with a computer. You can just talk to a person.
Exactly.
And to give you that, and then call the insurance company that you're thinking about.
Right, right.
You know, that might give you a little peace of mind doing
Right.
that.
Oh, I think so too. And, you know, like I said, a person could do it now and they can go back later. Now, people who are new to Medicare, of course, there's no pre-populated drug list on their Medicare website. However, they could put their prescriptions in and get their bottles of pills if they have it, because, you know, there's, you know, certain drugs where there's an HCl after it or HCTZ. All of those little letters and numbers are important. If it's a 24-hour extended release, it's important to put that in there. And actually, what happens is if I just put in a drug, I was just working on the venlafaxine or something like that. As soon as I put in VENLA, a list pops up.
Oh, good.
And then I can pick the drug I want, and then more things pop up, like, is it 25 milligrams? Is it 150? That sort of thing.
So it kind of helps you through it a little bit.
It helps you through it. So I just think that people should sort of be aware.
Okay. So big hint is go on the Medicare.gov site and do get an account going.
Right.
Sign up.
It's easy.
It's free. It's nothing to worry about.
Right.
And you'll get some information.
Right. You'll still get your things in the mail. You know, that's not changing anything. And, you know, use your email address as your username. It's easy to remember. And then they have some guidelines about passwords, but otherwise it's very straightforward on how to choose it.
Okay.
And, you know?
That would help a lot.
Okay.
And that is, I mean, when this is all coming up this time of year, I think sometimes, you know, it's a little panic time for some people, especially new to the whole process. So
Right.
don't panic. There's
Right.
a lot of help out there.
There's a lot of help, and one common question is, and then I'll stop, but, you know, sometimes people buy a Medicare supplement from one company and they think they have to buy their prescription drug plan from that same company, and they do not. There's no advantage to doing it, so they should purchase their Medicare supplement plan based on, you know, the plan that they want to go with, the company, and their prescription drug plan they should really base it on which is the most cost-effective for them.
Okay, there's no reason to get those together, whatever.
No.
ABC insurance, it doesn't. You don't have to do the whole 9 yards.
Right, exactly.
And then really think about your doctors and what you want in insurance and what your preference are before you get into the Medicare Advantage plans, because you want to make
Right.
a good decision about that too.
You want to make a good decision. And like I see husbands and wives, maybe one spouse will be on a traditional Medicare with the Medicare supplement, and the spouse may be on a Medicare Advantage plan. That's totally okay to do.
Right.
Because they're separate choices.
Right.
And everybody has different needs and wants.
And not everybody has like a allegiance to a particular doctor. I mean,
Right.
you know, that's something very personal, really.
Right.
Yeah.
Yes, it is.
Diane, before we go, anything else you want to throw out there to our viewers? Give them any
can't
other?
think of anything
I mean, we
right
covered
now.
a lot.
Probably think of some. Oh, just one other thing is for people who are financially challenged, for Medicare Part D, the prescription drug plan, there is a program called Extra Help. It's a federal program, and it helps people who have financial challenges possibly enroll in a Medicare Part D plan, and their premium is less or very little at all. They don't have to worry about going in the coverage gap. So if someone knows of somebody who is struggling financially, you know, maybe they could just, you know, Extra Help, they can call Medicare or Social Security, and they can explain the parameters for enrolling. And I believe Plow's Council on Aging could help people with that as well.
That's really nice for people who do
Yeah.
need that extra leg up. Okay.
Okay.
Well, thanks, Diane, for coming in. We always learn so much. And again, I just love the way Diane can clarify things for everybody. So thank you so much.
You're welcome. Thank you.
And thanks for watching us on Around Payless. And we'll hope to see you next time we have someone in to talk to us. Bye-bye.